Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality, disease-free years as possible. You know, I've been saying health literacy is the key to longevity for a long time, and if you listen to last week's show, guys, where we're taking apart what's called molecular structure, molecular medicine, we talked about Linus Pauling, and we really got down into a place where you have to see this stuff under a microscope. Hopefully you join me for part 2, because I know it's pretty intense. I know you probably don't think about this stuff, and I really do pray that I was able to translate from Dr. Jeff Bland's book, The Disease Delusion. We're in chapter 10 talking about structure, and I really hopefully was able to relate to you the protein function as it relates to structure. And we were talking about like having back pain, and do you get sore necks, and do you have a weight problem? And then we put it through the test of what God created for us, which was, how does God's structure that he gave us, the structure, or we related it to a skyscraper that has motion, this human structure, alter its function? Now, altered function is basically part of the disease process, right? So if we alter the function of the human body, we're going to get pain, disease, chronic illness. And we use various manual therapies like chiropractic, osteopathy, acupuncture, massage, and they impact the structure, which then impacts function. And there's been a lot of studies on that. So as we continue our conversation, at the very essence of who we are is this protein. Okay, so this molecular structure, this molecular disease that Linus Pauling, basically termed, is extremely important because it's very different than infectious disease. Infectious disease, we take an antibiotic, we zap it, we kill it. Molecular disease is very different. So we're looking at God's structure, God's function, and the impact it has on chronic illness. And Luke 1:37, for with God nothing is impossible. The better educated we are, the better knowledge we'll have to his design, and the better decisions we can make each day in our nutritional life, our psychological or a mental life, the way we interact with people, the way we think, stress reduction, and finally our physical life. So physical, nutritional, and psychological is the triad of health. And we're talking about structure. And now let's pick up from last week and sort of put this thing to the test and say, well, was there ever a time where a structural abnormality caused this physiological disease? What caused this? And a great example of this took place a long time ago, and it took place recently, and it's something called mad cow disease. Cattle, was typically raised on vegetable foods, and when there was a time in the late 1980s when cattle had traditionally been raised on this food, and what we did was the cost of the food went so high that the cattle farmers began to go to alternative food for the cattle, namely the remains of dead and diseased animals, both cows and sheep. So a few years after they started to feed the cows this new feed, they started to see a number of cattle, begin to show signs of a strange illness that, grew. They couldn't stand on all fours. They grew very aggressive. They seemed demented, and a lot of the cattle died, and that's why it was called mad cow disease. And it's a neurodegenerative disease. Okay, and so what cattle farmers did was they destroyed, 180,000 cattle. Okay, they found that were affected, and actually, 4.4 million were slaughtered. So they eradicated all of these cattle, and what ended up happening in 2009, about 166 people in the United Kingdom died because of this mad cow disease. 44 elsewhere in the world also died. So Dr. Bland in his book illustrates that as a point, because it's important to understand that here is something that a cow was fed that a human being ate. which caused mad cow disease. So a professor at a University of California started to study this, and he eventually won the Nobel Prize. So I'll cut to the chase. The guy won the Nobel Prize in 1977 because in 1997, because what he did was prove Linus Pauling's theory, which was that if this virus was the cause, and it caused a structural problem through ingestion, okay, that what he proved was that this story of eating the cow caused a structural change in the cattle. And that was done through ingestion. And he won a Nobel Prize for that. So what we learned through this is that structure influences function. And the structural information, now that's a key word, information, that defines our health and disease can be transmitted through food. Now stop and think about that, guys. Food is information. God designed you that when you eat food, drink water, you're actually supplying an information to your body. Now your body's structure and function is going to need to interpret that information. So, when we look at nature and we look at like foods from nature, foods from our environment, it's highly selective about the information incorporated into a specific structure. So what that means is the atoms in a molecule of food are arranged in a very, very specific pattern, in a very specific way, okay? And that piece of food gives information to the human body. Now, when this structure of that piece of food is changed, like in the case of mad cow, the information, okay, inherent in the structure is changed, and it impacts the way your genes are expressed, and therefore impacts the way your body functions. So that's how food, and we're going to get into obesity in a minute, that's how food causes structural change and causes a functional change. And it's very, very important, okay? So here we are in chemistry and biology, we're talking about native structure. And what that means is the structure that was present in the animal or plant in its normal state. So if you and I made a decision today, if you never heard me speak again, let's try to eat food in its normal state. Isn't that what God intended? Isn't that the very essence of what God gave us? He gave us native structured plants and animals to eat. So man alters the state of this food, thereby our bodies inherently take the information from that food and structurally change. So when we look around with messing around with the structure, okay, messing around with structure messes around with the way the body functions. And at a very personal, when you look at this, when you look at what you're consuming and how your body is functioning, there's probably a better way for you. There's a better fit for you. And that fit for you is why I do this show. Because that fit is called life. And God gave us a really well orchestrated environment, food, and physical condition through structure and function to allow us to be optimal. So food is indeed information. Now, let's talk about obesity. We've got an obesity epidemic in our country, and everybody's running around, right, wondering about obesity. Let's talk about it for a second. Obesity, or what we're going to call central obesity, that's around the midsection, okay? Fat stores in the body, specifically around the waist or abdominal fat. This is the most important type of fat, meaning that's the bad fat. We call it angry fat. Excessive fat around this section of your body increases your chance for illnesses like type 2 diabetes, heart disease, stroke, dementia, kidney disease, breast cancer, prostate cancer, okay? So the higher in the central fat deposit, again, that's mid-body, right around your waist, this is clearly evidence that central fat is in direct communication through the bloodstream, okay, through our intestines and our liver. The fat is going to this part of our body, certain type of fat, through structure. Again, structure determines function. So something in the body and where it is stored is structure, and that determines function. So why is it that fat in my arm is different than fat in my midsection? Well, there's a few reasons for that we're going to get into. So if you eat a meal that's really high in fat and sugar, your body, that's information, remember you learned it's information, sends off this informational messaging. And that informational messaging ignites angry fat. Now, angry fat is part of the immune system. In your immune system, gastrointestinal tract, remember 70% of your immune system is in your GI system. So it alarms this angry fat. The angry fat then is activated and it's found in nearby central regions of the body. And so it's the first hit. When you eat a bad meal, the angry fat gets really angry, it gets ignited, and for this reason, the greatest risk of chronic illnesses associated with fat accumulation comes from abdominal fat, because the abdominal fat is where the angry fat is stored, and we store more of it there with the bad meals and the high sugar diets. So what increases in fat in chronic illness is basically the direct impact of messaging, and that's information. Okay, information. Now, let's think about something for a second. There are plenty of people with excessive amounts of fat with no chronic illness. So we have to be careful out there, okay? Increased body fat shows, if increased body fat shows a risk of increased chronic illness. Why is it, not of it itself, a cause of chronic illness? What causes illness is how angry the fat is, okay? There are plenty of people, again, with excessive fat and no chronic illness, where there's plenty of leaner people out there who have type 2 diabetes and heart disease. So it's where the fat accumulates. We call this many times in my field, skinny fat people, meaning we'll take a person that looks relatively skinny and we'll measure them, their abdominal body fat, their total body fat, and they are clinically obese. But the body is storing the fat. You can't really see it, and that's why getting body fat measurements is so important when you're doing this kind of clinical nutrition, so you could see exactly where the body fat is stored. Again, that's angry fat. Too many of us have come to think that if we've been told that people are obese because they eat too many calories and they don't get enough exercise. And it all sounds reasonable, but you know what? Our bodies are much more complex than that, okay? We are, when you look at the way human beings are, we are not engines that just burn fuel. We are complex physiological beings that regulate energy flow and utilization in very sensitive and intricate ways, as Dr. Bland talks about. We have to take a look at calories as not a calorie in, calorie out. All right. Have you ever noticed, for instance, that people who carry around extra stored calories as fat are some of the hungriest people around? So now think about this. If they have all this extra fat on their body, that's adipose tissue, why is it they're hungry? They should be using that body fat, right, for energy. But what this would seem reasonable, but it's called switched metabolism. And what that means, many times people who become chronically sick and put on extra body fat on their bodies don't recognize how much stored fat they have, and therefore their bodies demand quick energy to meet their needs. So they're eating all the time. And what we have to do is switch metabolism, okay? And it turns the hunger mechanism around. And if you're able to do that, which we do all the time, and you switch to metabolism, then you're going to get the person on the right road to better health. And that is the individual's structure and the individual's function. So let's stop talking about just genetics as it relates to, obesity, because there is no gene that's ever been discovered that tells us you're going to be obese. Okay, we have hormones, right? We have toxic chemicals, we have pollutants in our environment, and these are the things that directly relate to the formation of angry fat. Bad information from food, really bad poisons in our environment that reduce our mitochondria in our cell to produce energy. And number 3, this leads to the change of our structure, resulting in a change in the way our physiology functions. Man is doing this to man. We have created an environment with bad engineered food, which then sends in bad information, creating an angry fat response. We have created a polluted environment, which affects our mitochondria. So many people lack energy, so many people lack good oxygen, and so many people are eating really bad calories that get stored in fat cells, and we are changing the very physiology that God designed us with. And ladies and gentlemen, that is the story. And if we want to understand chronic illness, we have to take a real hard look in the mirror, and it starts with the foods we bring in our house. Be very conscious of not eating engineered food. Let's get back to those foods that are normal, that are native in nature, the ones that God created for us, that were by His design. Thank you for listening to me, Dr. James Proodian, and the By Design radio program. If you need more information about me, please go to ProodianHealthcare.com. If you'd like to catch up on any of my earlier shows, please go to my YouTube channel. Have a blessed week, and let's eat well.